Hi, I'm Kim Woodbury, Director of the Miami Valley Small Business Development Center in downtown Dayton. And today we're going to go over the guidelines issued by the Governor's Office to safely restart restaurants and bars. It is May 12th, and this is the best information that we have right now. So restaurants and bars in Ohio will be permitted to open very soon. The dates are May 15th for outdoor service and May 21st for dining in. The reopening guidelines were developed by a working group of Ohio restaurant owners and other industry professionals like the health department. They also have some webinars on their website, which is down here, that have a lot of information and answer a lot of questions as well. Okay, I'm going to go and just take a peek at the guidelines real quick. These were the guidelines that were issued on May 7th, and we're going to go over these recommendations one at a time. I will post these on our website, which will be, which is sbdctec.com. But you can also find these on, if you searched on Google. Okay, so the bottom line is that COVID-19 is still with us, and the guidelines were created to keep conditions that will ensure continued operations. So they're to help you, your employees, and your customers stay safe and healthy, and also to promote customer confidence. If your customers are not confident that your establishment won't be able to keep them safe, they won't be your customers. Okay. So the guidelines have two parts, mandatory and recommended best practices. Throughout this presentation, I've tried to discuss mandatory measures first and then the recommended for each item listed in the guidelines. So the guideline areas are employees. There are four areas: employees, customers and guests, physical spaces, and confirmed cases. We'll take these one at a time. Okay, so the first area is employees. It's mandatory that you have 6 feet of space between employees whenever possible. The working group realizes that some back of the house areas can be quite cramped. So if it's not possible to have 6 feet of separation between your employees, you can use barriers, increase the frequency of surface cleaning and hand washing, and monitor your employees' continued compliance. The working group also suggested that it can help if you assign designated workstations for each employee and establish safe traffic patterns throughout the facility. If people are going to use the sink, there should be one way to go to it and a way out. Discuss the traffic patterns with your employees so they don't end up with a congestion issue that you're all standing in the same spot. Okay, the recommended best practice relating to employee spacing involves third-party delivery staff. Delivery people should wait outside or in non-congested areas. They should be encouraged to practice social distancing and also be encouraged to wear face coverings. These are delivery drivers that are coming into your business. You would like them to keep your area safe as well. Okay, we're still in the employee section, and it is mandatory that employees wear facial coverings. Face coverings should be made out of cloth or fabric, and they should cover the nose, mouth, and chin. They do not have to be masks. Bandanas or scarves are acceptable. There can be some exceptions to this rule, and these exceptions are if the coverings are prohibited by law or religion, if they violate documented industry standards, if the employee has a health reason that makes face coverings inadvisable, if the employee works alone in a designated work area, or if there's a practical reason not to wear a face covering. The working group specifically mentioned grill and fry cooks and the fire hazard that exists with fabric coverings. They also mentioned that an example of someone with COPD being unable to wear a mask for health reasons. Now, if there are employees that do not wear face coverings, the business must be able to provide written justification for the decision if requested. So make sure you have that documentation. You can even have customers that question it, and then you should have a ready justification for them. It'll make things a lot easier. The work group also discussed that if you have wait staff or someone working in the front of the house that doesn't wear a mask, you could get substantial questioning or pushback from your customers. So you might want to find a job for that employee that isn't customer facing if possible. You want to be very cognizant that what people see makes them feel secure and eager to return. Okay, recommended best practices for this area is that you provide your employees with face covering education. That includes proper use, disposal, and maintenance. It's also a good idea to re-educate your staff on the proper use of gloves per the existing health code. Okay, we're now at the part of the guidance I think is the most vague and most tricky. The guidance says that it is mandatory that employees perform a daily symptom assessment at the start of each shift. This assessment includes taking their temperature with a thermometer. The current symptoms listed by the CDC are cough, shortness of breath or difficulty breathing, and or two or more of the following: fever, chills, repeated shaking with chills, muscle pain, headaches, sore throat, and a new loss of taste or smell. These all could be an indication of COVID-19 infection. These symptoms that are accepted may change, so this is something you should be keeping up to date on with the news, etc., to find out, and with the health department to see if you need to update this at any time. So even though they describe that they must perform a daily symptom assessment and what the symptoms are, there's no discussion of what you're required to do with the employee assessments in the mandatory section. The recommended best practices discuss what the health checks can include: temperature assessments, questionnaires, employee self-checks, screening apps, or other tools. And they also include updating files with a log of health checks. This section made me feel kind of uneasy because it seems so vague, so I spoke with a local lawyer for his interpretation. He indicated that he thinks you should keep a record of the health assessments. This is to protect yourself and your business from potential liability issues and to prove that you're following the guidelines set by the state. So make sure you keep these assessments secure and separate from other employee records, maybe in a binder or a folder, the way you keep I-9 forms separate. Really consider privacy and storage of your employees for your employees when you're setting this up. The lawyer I spoke with also recommends adding an emergency section to your employee handbook, indicating that health checks will be a required condition of employment. That way, you have recourse if an employee refuses to conduct the assessments. The emergency section needs to be distributed to employees, and they need to sign that they received, read, and understood. That's the same thing you would do with a regular employee handbook, but you should do that with this emergency section as well. He also indicated that if you don't consistently do the health checks, it might be worse than not doing them at all. Gaps in the reporting could cause issues down the road. And since they are mandated, you must do them, but check with your own HR service or lawyer to get their recommendations on how you should keep those records. I also would be very careful not to be overly invasive into your employees' health. Although these health checks are mandated by the Department of Public Health, your employees still have rights to privacy. So I put together a health checklist that the employee could fill out. And I believe something like this would put the responsibility on the employee. But again, if you use this checklist, get it okayed from your legal advisors. And this, the form that I came up with is the employee themselves indicating if they have those symptoms and what their temperature, that they've taken their temperature, and it's done daily with their signature. So that shares that or puts that responsibility on them. Okay, so as we move on to additional recommended best practices, as you start to bring people back, you should consider interviewing them virtually and doing the onboarding virtually if you can. Okay, it is also mandatory to provide ServSafe or other approved COVID-19 education as soon as possible to your employees. You should also add COVID-19 symptoms to the current standard health agreement required by the Food Safety Code. So the Franklin County Department of Health provided me with a generic form that I posted on our website, and I'm going to show you that right now. Here we go. It's very similar to the Employee Health Policy Agreement that you also have and have your employees sign, put it in their records, but it does add the COVID-19 symptoms. So that form, they should read and agree to it, sign it, and put it in their files. Okay, and I also went to the ServSafe food handler website, and they have an offer for food handler training that's been extended through May 31st, 2020. So if you get there early enough, you probably can get that training free for your employees. The website is at the bottom of the screen here, but you can just Google ServSafe the way I did also. Okay, another mandatory guideline is that you must require regular hand washing by employees. So the tip provided by the work group was that the code does require hand washing every time employees switches tasks or change gloves. But they suggest adding a 2-hour interval for all employees to wash their hands, and you can determine that with a timer or some kind of alarm so that everyone is doing that. Now, glove use is as mandated by the existing code. Cashiers and servers are not required to wear gloves. The thought is that there's a greater potential to spread germs wearing gloves in these customer-facing jobs. Regular hand washing and sanitizing will be more effective with less risk of passing germs from one customer to another. Wearing gloves sometimes makes people they feel safe, and they don't, so they may not be cleaning and changing those gloves very frequently and then pass the germs along. So cashiers and servers are not required. But there's some concern that there might be some pushback from customers if there isn't consistency across establishments. You might find a need to put signage up indicating that gloves are not recommended for cashiers or servers, especially if you have, if there's a establishment down the street that is having their cashiers wear gloves. But that isn't recommended. So the recommended best practices are to reinforce education per the current food safety code about when to wash hands, to post health department hand washing posters at sinks and stations, set periodic times for hand washing, avoid switching tasks when possible to reduce cross-contamination concerns, and increase hand washing if changing tasks is necessary. Okay. So the last mandatory guideline relating to employees is that you must comply with person in charge and manager certification requirements. You must maintain compliance with Ohio Department of Health, Sanitation, and Food Safety requirements, and you must limit the number of employees allowed in the break room at one time. Employees must practice social distancing in the break room just as they do in the main part of the restaurant, and the maximum employees in a break room at any time, depending on the size of the break room, is per the state group guideline of 10 people. Okay, we're going to move to customers and guests. It's mandatory to ensure a minimum of 6 feet between parties, both waiting, dining, and at the bar. If it's not possible, use barriers or other protective devices. Parties cannot exceed 10 people, so you can have parties that sit together. They come in together, they sit together, but they need to be separated from other parties. So you could have, say, a 6-top table with one group sitting together, but then the next group has to be 6 feet apart from that party. So some tips from the work group are that barriers should be easily cleanable, non-absorbent material, and that high back boosts may be sufficient as long as the guests can't turn their head and cough and project germs to other people. Plexiglass might be a good, to extend the height of booths might be a good idea. So a recommended best practice is that guests should be wearing face masks at all times except when eating and drinking. Okay, so it's mandatory that you post a list of COVID-19 symptoms in a conspicuous place for your customers and that you ask patrons not to enter if symptomatic. You also need to place approved hand washing and sanitizing products in high contact areas. The recommended best practices are to post health questions at the entrance. Do you have a headache? Do you have muscle pain? That kind of thing. It is also recommended that you identify a dedicated entrance and exit door if possible. Enabling so people come in one door and go out another. Make sure that anything that you are doing is still following fire code though. So you also want a recommended best practice is to enable dining room ventilation. That could be open doors and windows if you can do that. Okay, it's mandatory that food service establishments that offer dine-in service must take affirmative steps with customers to achieve social distancing. One tip is that you will have the greeter or the host set guidelines when the customers enter. It would be they should indicate that compliance is required for service, and also it might be a good idea to pass out printed rules if you're concerned that customers are not going to follow the guidelines. This could be especially important with establishments that serve alcohol. You want to make sure you get the rules down right when they come in before there's any alcohol use, probably. You don't want anything to get out of hand. Okay, so to avoid congestion, it's recommended that you encourage customers to make dine-in reservations or use the drive-through, pickup, call-in, curbside, or delivery options. And also encourage at-risk populations not to dine in, but to use those alternative options, such as the drive-through, pickup, call-in, curbside, or delivery options. to keep them safe. Okay, we're to the area with physical space, the guidelines for physical spaces. So it is mandatory to establish and post maximum dining area capacity using updated COVID-19 compliant floor plans. Maximum party size per state guideline is currently 10, and you should post a kitchen floor plan establishing safe social distancing guidelines as well. And make sure that you follow established state health department guidelines for masks and gloves. Now the maximum dining area capacity, you will determine what your safe seating is for your restaurant. Maintain that 6 feet distance, and that would be, you would post that for your customers to see. Okay, so it's recommended to use barriers in high volume areas, to stagger workstations so employees avoid standing directly opposite or next to each other. And if that's not possible, increase the frequency of surface cleaning, hand washing, sanitizing, and monitor compliance. With physical spaces, daily cleaning is mandated for the entire establishment. But between seatings, you also need to clean and sanitize tabletops, chairs, and menus. And anything that's a high touch area should be cleaned at least every 2 hours and more frequently if needed. And that would include things like door handles, light switches, phones, pens, touch screens, restrooms. Also recommended best practices are to enhance your weekly cleaning, a weekly deep cleaning checklist. Make sure that you're doing an extra heavy duty cleaning weekly. Consider posting communication to indicate if a table has been cleaned. So maybe you're going to put a post-it note on a table that's been already wiped down and disinfected. And if you could use disposable menus, that will also be a good idea. So you don't have to sanitize them between seatings, and it'll also reduce the risk of germs substantially. All right, also mandatory for physical spaces is that you should provide approved hand washing and sanitizing products in common areas. So at the cashier's desk or anywhere that a lot of people will be frequenting over a period of time. When it's appropriate, you should establish ordering areas and waiting areas with clearly marked safe distancing and separations per individual party for both restaurant and bar service. So I know everyone's seen at the grocery store the feet on the floor that say how far you have to stand between each other in line. Some of the grocery stores have arrows. You go this way down an aisle, and then you can only go the other way, one-way aisles. So wherever that's appropriate, you want to establish those and mark them for your space. Okay, so recommended is to limit entrance and exit options. That's using one entrance and one exit whenever possible while still maintaining code regulations. And encourage and continue to use designated curbside pickup zones for customers. It's also mandatory to remove all self-service areas and table and common area items. So you will remove table tents, any kind of vases, lemons, straws, stir stick, condiments. If customers say request ketchup, you'll bring it to them, and then you would if it's a bottle, you'd wipe it off after use before using it for another table. So also mandatory is that although salad bars and buffets are permitted, they have to be, a staff member has to serve the guests. And there should be safe social distancing between people that are waiting in line for that salad bar or buffet. This kind of ends up being kind of cafeteria style. But that way it keeps the handles clean. It keeps people from getting too close or sneezing on the food, that kind of thing. Okay, so recommended best practices would be posting health department best practices, highlighting continuous cleaning and sanitizing of all food equipment and common services, and to continue to emphasize employee education and compliance with hand washing, glove use, employee health, and food handler training. Private dining and bar seating areas must follow all approved safe social distancing guidelines, and the seated customers or parties must be 6 feet apart, not just the tables. So you wouldn't set up your dining area with 6 feet between tables. It would be 6 feet between where the customers would be sitting. And I believe I already mentioned this, but you can look at, that you can have the tables themselves with the parties don't have to be necessarily 6 feet apart because they're a party, but the parties themselves must be 6 feet apart. Okay, so it's also mandatory to keep closed any open areas where people congregate that are not necessary for preparation and food service and service of food and beverage. So that would be like pool tables, card playing areas, arcade games, any place where dancing would go on or any kind of entertainment. This does not mean you can't have entertainment. It just means that you can't have an open area where people would congregate to watch that. So if people are staying at their table and listening to, a band or a singer, that would still be okay because this safe distancing would still be in effect. Okay, so recommended best practice for physical spaces is to consider an air filtration improvement within your HVAC system. So if you think that you can improve that, I would have a specialist come out, an HVAC person come and look and make some recommendations so that your air filtration system is up to standard or up to par. Okay, so now we're going to move to what's mandatory if you have confirmed cases of COVID-19. So you would immediately isolate and seek medical care for any individual who develops symptoms while at work. You would need to contact the local health district, and you would shut the area down for deep sanitation if possible. If you don't know how to reach your local health department, you can go to this website here and find out where your local health department is. I'm sure most everyone is familiar with that because you've dealt with them when you've set up your restaurant. Okay. So recommended best practices are to work with the local health department to identify potentially infected or exposed individuals so that you can help with contact tracing and notification of exposure. Once testing is readily available, which it is not now, but once it is, you should test all suspected infections or send them to be tested or exposures. Following the testing, you should contact local health department to initiate appropriate care and tracing. I also, from the Franklin County Health Department, I also got some guidance if I can find it, that talks about how to communicate with your health department, what things you need to provide, what isolation means, what quarantine means, and what to do while you're in quarantine. For example, self-monitoring, taking your temperature twice daily, etc. So this is also on our website. I'm not sure, you might be able to find it on the Franklin County Department of, or Health Department's website as well. But this is a great piece of guidance as well. All right, so we are done with the guidance. And I just want to highlight a few more things about preparing to open. So what you should do is think through this guidance and develop a plan. And so think it through, maybe talk to some other people, write it down. You want to have it written down so that you can show that you do have that plan. If asked, you should establish and post your maximum capacity floor plan and focus on employee training, because whatever plan you have will only be good as it is implemented by your employees. So you need to get your employees to buy into this and to have adequate training as well. So you probably also want to do some customer training. It was suggested that you might want to have some kind of dedicated employee to enforce the policies. This person should be very personable and hospitable, and fully understands the policies, but is also comfortable enforcing them. They also recommend having a script, so this isn't something new that they're going to have to deal with. It's something that they can have something to fall back on. I think this is going to be especially important if you serve alcohol. And I do think that setting those guidelines immediately when they walk in the door is going to help with the customer training. When you're thinking about the person who you're going to have as a dedicated employee to enforce the policies, really consider how they interact with your customers, and if they are up to the task. Sometimes if it's someone that's maybe more shy or not very forceful, that might not be who you want. You might also consider gender for this, because there might be some people that don't listen to female sometimes, or to people who are especially young. So all those things you should think about when you're picking your people that are going to enforce the policies. Okay, and then I've got some other notes. So Ohio is not limiting parties to family members like some other states. They don't feel that they can get you show birth to prove that this is a family member. There's no way to do that. So they're not limiting it. They're just limiting the parties to no more than 10 people. And the reopening plan doesn't currently extend to banquet halls. There is still that 10-person gathering cap that remains in effect for banquet halls. You should get legal HR advice if you have some concern about HIPAA, which is spelled wrong, HIPAA, and health screening and Americans with Disabilities, or anything that you have questions about with your employees. Definitely get some HR advice. One other, I had a question earlier when I did this live. So some states are also saying that you can have 25% of your maximum occupancy, or 50% of your maximum occupancy. But Ohio has decided that it's better for you to look at that floor plan and decide how many people you can fit in and still maintain your distancing. This to keep people safe. So if they have you at 50% occupancy and it's not set up so that you can keep people 6 feet apart, that wouldn't be good. So they're taking more you need to figure this out approach to make sure that you're following the rules. Okay, that's all I have. If you have any questions, make sure you contact your Ohio Small Business Development Centers if you're in Ohio, and you can do that at clients.ohiosbdc.ohio.gov. Um, for those of you not familiar with the Small Business Development Centers, we do one-on-one confidential counseling and trainings for small businesses, and that's at no cost. We're all over the state. There's more than 25 different centers in the state, and we are also all over the country. So if you happen to not be in Ohio and are watching this, definitely to find your nearest SBDC, go to americassbdc.org, and you'll be able to put in your zip code and find the centers that are closest to your location. Okay, have a great reopening and stay safe. Thank you.